Good afternoon and welcome back to this teleconferencing session of PGDHHM program. Friends, before the break we have discussed about the equipment management and we received few questions also. Still there are any questions, you can fax your questions or you can ask your questions. Now this particular session in next 40-45 minutes we will be talking about two other important areas of the hospital, and those are laboratory services and the blood bank services. You know that the laboratory is a very important clinical area in the hospitals, and nowadays with the introduction of Consumer Protection Act and other legal responsibilities, it has become imperative to establish a diagnosis before the treatment is started. Earlier, in the earlier days, people used to rely more on the clinical aspects rather than the diagnostic services, but now it has become imperative for fulfilling the medical legal responsibilities, and also because the nature of disease has changed and the diagnostics, there have been so much sophistication in the diagnostic techniques, so it has become imperative to establish the diagnosis for all these reasons, and so these becomes very important areas. And to discuss about this laboratory services and how to establish a blood bank and what are the various criteria for a donor and what safety precautions we need to take care during the establishment of a blood transfusion center, we have got with us Professor Das. He'll be giving you a presentation for half an hour or 40 minutes, and then meanwhile in between also if you feel like there are some questions you can ask, otherwise after his presentation also you can ask. So Professor Das, please tell us, our learner, that what is the importance of the laboratory services and how they can go for planning and organization of laboratory services in a hospital, and what are the things which they should keep in mind while establishing these services.
Thank you, Professor Arora, and very good afternoon to all of you. Professor Arora is absolutely right. I mean, those olden days are gone when we used to call bhala doctor ka bhala. That means stethoscope is the last and final thing to diagnose any disease, and the doctors usually used to depend on the signs and symptoms of the patient, and based on that the diagnoses have been made. Rarely, occasionally they were just consulting the laboratory reports, but the present scenario is just opposite. Until or unless you are totally confirmed by the laboratory investigation reports, you are been given the the confirmatory the values for this thing, a physician really hesitates to come to its final conclusion or final diagnosis. Well, with this thing on the rather, and this may be the another very important impetus, that is why that laboratory services is now growing in leaps and bounds, and maybe in the present scenario in a hospital next to the operation theater and your critical care areas, laboratory may be the largest cost center or the most important cost center for a hospital. Now let us see what are the aspects we need to consider or need to do it. Now, laboratory services are an integral part of our healthcare delivery system. There's no doubt about it, and most of the patients are required to undergo some kind of lab investigation to facilitate diagnosis and also to monitor their progress. So this is not only for the diagnosis but for the prognostic aspects also, for a disease, particularly the long debilitating diseases, and also in a very acute the acute stage of that problem, in particular the emergency situations and all, we need to depend on this laboratory process. Over the years, laboratory services have undergone sea change. That means shift to high levels of automation, and it is all olden days are gone when we really used to have those the reagents, the test tubes, the burners and all those things, and you really need to mix it up and do it. Nowadays it is done either by that automated, semi-automatic machines or automatic machines. But along with that, you require to have highly skilled personnel also, who will be able to really do these things, interpret it properly, and have that correct result also. And definitely, of course, this is an area of high revenue generation, and not only a revenue generation, you have to have a very high investments also for getting all these things done. So as per the definition, a laboratory is a facility that supports patient care by providing diagnostic and management information to the caregiver. Its ultimate goal is to provide accurate and timely results for diagnosis, treatment, and monitoring of the patients. It may be a part of the hospital complex, or it may be a freestanding facility, and that is why you have seen in our healthcare delivery system, this laboratory services has become a very lucrative business kind of thing, and so many laboratories are there all over any of these cities. If we look into the evolving role of the laboratory services in healthcare, labs are the most important revenue generation component in the mega billion-buck industry that healthcare has become, and it goes up to, particularly in India only, this market amounts to 1,500 million US dollar. Nearly 19% of this is related to the diagnostics. The number and variety of lab tests are increasing at a tremendous rate, and various studies they have given that the rate at which this requirement is increasing is varying from 8 to 14% per year. At this rate, this requirement or demand is increasing. A small variety of tests account for a major proportion of the tests being performed in the labs. Well, on an average, 8 to 10 tests are performed on a patient, excluding the specialized or radiological tests. So, whenever a patient is coming to or admitted to your hospital, you require on an average 8 to 10 type of tests per patient per admission. The reasons for explosive growth in lab services, definitely one, that is the increased automation. So it becomes very easy. Just take those printed pro forma, take a little bit of blood or serum sample, put it into your machine. The machine will be doing everything, and the results will be coming out. So increased automation is definitely, putting the pressure. Second is increased monitoring of the disease by lab tests. Doctors have become much more dependent to find the prognosis of the disease on this lab test or the reports from the labs. Then, as Professor Arora was telling, that is the medical legal reasons. Now this becomes a very big safeguard for the treating physicians. They can always show it as the report was been given like this, so that is why they had to take this action, or they had to do this procedure. Then increased reliance of doctor on lab test for diagnostic purposes also, and follow up abnormal results discovered during the routine screening. That is also very important, and you have seen that particularly for the non-communicable diseases, most of the time while that routine tests are being done, suddenly you will find the patient is suffering from diabetes, or having some thyroid problem, or having some kidney problem, or things like that. So that is also another aspect. That is why we are going for it. And you have seen in many of the places, particularly in the corporate houses, that employees are being asked to go for the regular annual checkup or 6-monthly checkup, where all these things have been done just to monitor and see that their health condition has been properly taken care of. So with this background, let us see what are the objectives of laboratory services. First and foremost, to provide comprehensive, accurate, and timely analytical test results for diagnosis, monitoring, and treatment. This may be the most important aspect for your laboratory service, or the objective of your laboratory services. Second, to collectively consult with the clinicians regarding the most useful application of scientific procedures of patient care. Yes, definitely, and that is why in any teaching hospital, and for all the big non-teaching hospitals also, whenever there are some case meetings going on, some academic things are going on, these lab people are always been called, and their inputs are very seriously taken care of also. Third, to train professionals and technical staff for developing their service, and definitely, of course, the fourth one, that is to conduct various research. If we look into the functional components of our laboratories, laboratories can be mainly divided into this 6 or 7 categories. Like, one is the histopathology, clinical pathology, microbiology, hematology, biochemistry, and definitely the research laboratories where we are having our animal models also. While we are planning a lab services, it should be a complete team approach. Inputs from all concerned persons should be taken so as to prevent inefficient use of improper designing of the lab services. And who are these people? First and foremost, definitely the clinical pathologist, architect and hospital administrator, and the clinicians who are going to use the services of this laboratory. So the representatives of this category will be there who will constitute the team and to finalize their initial planning and designing of the lab. While we are organizing and planning, the factors we need to keep in our mind are the general considerations, facility planning, materials management including both that what Professor Agarwal in the morning was discussing, that not only the equipment management but also all your reagents, which forms a very big important aspect for your lab services. So it is not only the equipments, the automatic machines, but also the consumable items also. Then human resource development, quality assurance, one of the biggest and the most important aspect of the hospital where this is required, that is in the lab services. And last but not the least, but it is very, very important, is information management. So let us come to these things one by one. First one is the general consideration. A complex integration of expertise in medical, scientific and technical areas. Yes, there is no doubt about it. Adequate resources in the form of personnel, lab and data processing equipment, facilities and equipment, as well as skill in the organization, management and communication. This communication part is also plays a very, very important and crucial role in this laboratory management. A wrong reporting or the proper reporting but transferred to a wrong patient will be disastrous. Awareness of the accreditation standards and government regulations of laboratory practices. Incidentally, these things are very much there in our country also, and it is a happy thing to note that most of our laboratories are aware about these things and they are really striving for this. Physical facility planning, sections that have to be organized in the lab, workload in terms of number and variety of tests to be performed, that is beds patient being catered to, areas of the hospital that lab is expected to cater, that is OPD, emergency, indoors, nature of the prescribed tests, that is which are the urgent, emergent or the routine type, technical equipments peculiar to a particular area in the lab, and area and space requirement to accommodate various equipments, furniture, personnel in technical, administrative and auxiliary functionaries. Then of course allocation of the space, future expansion, you should have that facility or scope for future expansion. Identifying electrical, plumbing, lighting, air conditioning, all these things. Working out the standard size in terms of lab module and aligning sections of the lab in a way that alteration and rearrangements are possible in future. Labs are of the following two types. That is the centralized lab and decentralized lab. Definitely, of course, if the hospital is of a smaller size, in that condition it is always better and economical to have a centralized laboratory service. That means lab is in one area, and whether it is your indoor facilities, whether it is from your critical care area or it is from the emergency department, that same lab will be catering or providing the services 24 hours. But if it is a big hospital, in that condition you need to have the laboratory services available in those areas separately. Like emergency department should have its own laboratory service, the critical care areas may have their own laboratory service, and a centralized laboratory service with all other facilities should be there for the main hospital where you can take care of the indoor facilities. Location, I think it is all known, it should be ground floor between the OPD and wards, that means it should be easily accessible, should have the future expansions, but most important that it should have a separate central sample collection center near the OPD, and this is an area where all type of samples, whether it is for the hematology or biochemistry or routine pathological kind of things, all the samples should be collected in the same place. Hence, you must have a proper waiting area, a proper venipuncture room where the blood samples are particularly taken, and a separate dedicated toilet, separate for males and females. Most of the time you will find in our hospitals, the patient was been asked to give the urine, and while he or she is, that bottle has been given, and that she need to collect that urine, but she will, or he or she will, may not be finding that proper place where she can collect it. So the provision of the toilets is a very, very important aspect. As per the space requirement, we are having various norms and standards. One is that National Health Scheme of England, then COPP of 1965 Government of India thing, a DGHS one, and the scales of accommodation for the Armed Forces Hospital. Space requirement as such, thus required for the technical and professional activities to support the activities and the movement of the circulation of the staff. You can divide it into three basic areas, that is primary or the patient care space for primary task of carrying out the professional work expressed in terms of lab space unit, which is the main area. Then secondary and supportive space for supportive activities, and third, the circulation space for uncluttered movement of the personnel and material within the department between various workstation rooms and stores, etc. So primarily or virtually these are the three primary spaces we should have. Lab space unit is a basic unit of planning for the hospital labs, can be an enclosure or maybe it in the open bay, can house small groups of technicians, or arrangements of the equipments may be subdivided and used as a part of open lab space. One of the most suitable lab space unit is 10 feet by 20 feet, giving a module of 200 square feet area. And what is this module? Modules are exactly, that is a complete setup where all the requirements which are required to conduct any laboratory investigation should be available there. Top of it, you need to have this provision for 30% space for your circulating areas. 10 to 15 square feet of space per bed plus 25% more to be incorporated for your future expansion. Rappaport manual. Rappaport is a person who is having, worked on this area, and he is having those manuals which are internationally acclaimed and accepted. And as per that manual, lab planning and designing, which has been given by the College of American Pathologists, the thumb rule says 6 square meter for every person working in a lab area should be the lab floor area. For every person they are working, that much of requirement. It does not include the circulation space and supportive area, which may account for another 30% more, which I have already told, and another 15 to 30% more space to be added for other functions such as storage, administration, maybe keeping those carts or those trolleys, etc. Estimated space for the lab based on that number of tests done per year. As per the report, it requires that 45 tests per year can be expected for that net lab area. Therefore, the anticipated number of tests per year divided by 45 will provide a rough approximation for the net lab space required. Example, in a hospital, say for average estimated number of tests per year is about 45,000. Hence, the lab space required for this hospital would be 45,000 divided by 45. It will be 1000 square feet area. So that is how we roughly estimate the lab space requirement. The other ways of estimating the space required may be 75 square foot per worker will be required, that is which will include the bench and the floor area, but definitely it will not include the space for incubator, refrigerators, oven, centrifuge, sink areas. These are the things which are shared between the workers. Another 150 square feet per worker include all the above mentioned things, and 300 square foot per worker which includes the B and plus additional areas also will be required. So that is how the other way of estimating your requirements. So I think we can skip off those things, that walls should be of the impervious type, crack free, properly things, ceiling. The floor should be resistant to the acid, alkali, solvent and histological stain, should be easily clean and not slippery, and all those things should be there. The door should be wide enough. Windows, that 20% of the floor area should be covered by window, because you will be requiring lot of natural daylight for these things. That air handling, electricity, lightning, we require almost 750 lumen per square meter lightning. It should be noise free, dust free, and pest and rodents should not be allowed, definitely, of course. And the workbench, I mean 2 meter per technician will be required, that is 6 meter length of a lab module for where 3 to 4 technicians can work. Height of the bench should be varying between 75 to 90 centimeter, width 60 to 75 centimeter, and stools 45 to 60 centimeter in height. Then purchase and product specifications. Well, these are the requirements for our chemicals and other things. Maybe we need not to go into the details of it, because these are all given in your modules. Automations to provide hassle-free services, but maybe it sounds very easy, but you need to maintain them, particularly for the calibration and standardization of all lab equipment is mandatory. Manufacturer's instructions to be followed meticulously, and annual maintenance with the manufacturers and authorized dealers should be entered into. And I am thankful to Professor A.K. Agarwal, because in the morning he, in a very detailed and in a very comprehensive manner, covered up all these things. So all those principles are to be remembered and applied for these things. Then purchase and product specification, the terms and conditions for the procurement procedure should be laid down properly, and we may in general follow the Bureau of Indian Standard guidelines, which are available for your procurement and the purchase of lab items for various types of hospital. Those can be referred to. After this material management or the planning of the equipments and the consumable items, next is the personal planning for the lab. While we are planning for the number of manpower or human resource, we need to keep in mind the workload, the degree of automation we are having, the emergency services to be provided, and also to keep in mind the leave reserve. For the staffing, no published document of reference is available, but in general the norms for lab for a 100-bedded hospital is something like that: one head of the department, a pathologist, senior technicians 4, technicians 8, lab assistant 4, lab attendants 4, sweepers 2, one personal assistant, and clerk 1 each, that is the ministerial staff. Well, these are not the standard guideline. These are as per the developed and as per the requirements, and most of the teaching hospitals, they usually follow this. We think I can do this. Now for the lab information system, that is the registration system, sample collection, identification of the OPD cases, leveling and transporting of the samples for the processing. Well, these are the things which are kind of a checklist kind of thing we need to follow and remember. Fourth, word sampling collection personnel, that is identification, location of the patient, sample registration and transport of that sample. Messenger system, that is the receipt of the sample and transport of the results. Nurses to maintain accurate records. Technical staff, that is preparation of the samples, rechecking, identification of the system of sample, processing the samples with proper leveling and codes, because nowadays instead of leveling it, there are many of the hospitals where it is fully automated, they use the barcodes. So recording and observation of the results, because while you are using the barcodes and the computer has been added to it with that local area networking, all these things are not required to maintain manually. So immediately they are being stored and been disseminated to all the treating physicians. Checking and rechecking of the system by the supervisors or the pathologist. Final reporting, recording and index system, and then that issue of the reports. Now if we can do this, the benefits are reduced errors. That means mischarted reports, specimen mix-ups, calculation errors and transaction errors. So if we can follow those steps, we can reduce or minimize these problems. Then it will definitely improve the staff productivity, rapid availability of the results, simultaneously and easy transmission of the results to all areas, improve patient reports, and definitely better data for quality assurance. For doing this, the policies and procedures, recruitment rules according to the Government of India, then accreditation and research and training of the employees. Hence the samples sent from the others, I think we have already discussed. That's the reports, records and all these things. Now, think on what is a reliable result. It is an accurate, precise, specific and sensitive result without, I will not say the gross error, without any error. But definitely there should not be any gross error. And possible sources of error are, that is the pre-instrument phase, which accounts for 65 to 75%. Instrument phase 6 to 7%, because while you are doing in the automation, this things comes down heavily. And post-instrument phase, which varies from 18 to 25%. Sorry. To control all these things, we need to have that quality assurance and quality control. As I told you, these are the two very, very important aspects in our laboratory management. Now, these are the few of our pre-analytical factors, that which includes the preparation of the patients. It might happen in the sample collection, it may happen in the storage, means while before transportation you need to store somewhere. Then collection of the supplies, kits and equipments, that means which are coming to your laboratory and used as your consumable items. During your processing, we need to have the thorough quality control procedures. That quality control in the laboratory is defined as the study of these errors which are responsibility of the laboratory and procedures used to recognize them to produce the reliable and reproducible results. Some of the common causes for errors are collection of the specimen not properly collected, provision of the suitable container. You are collecting something which should have the EDTA solution, that means it should not be coagulant, but that EDTA was not been properly given, or given in a very small quantity, the blood clotted. Then instrumental error, the instruments are not been properly calibrated. Then chemical analysis error, calculation of the and typing errors while you are doing it manually, and wrong specimen identification. So these are some of the commonly occurring kind of errors, and to avoid this, quality control program is further subdivided into external quality control and internal quality control. In external quality control, that is the other agencies while doing, I will be coming later on. And internal quality control is use of internal standards. You fix up the standards and try to conform with those standards. Use of some unknown samples, try to analyze that and then try to tally that result of that unknown sample with that standard report. Then other quality control charts. For the post-analytical factors, this include handling over the correct report to respective patient and proper understanding of the same by the respective physician. If we are not been able to do this, we will cause some disasters. Coming to the quality assurance in labs, quality assurance is a process by which the accuracy of the test is assured. Objectives of the quality assurance is resolved around the notion that a test done wrongly is worse than a test not done. And it has got two objectives. The primary objective is to ensure the result of an analysis of the patient specimen is reliable enough for application in his or her care without any doubt and does not lead to incorrect clinical interpretation. That is our primary objective. And overall objective, to ensure the results obtained from one lab should be comparable to all others using the same method within the degree of statistical significance. Hence, easier for the lab test with the objective interpretations than those with subjective interpretation. So we don't have any scope for any subjective interpretation in our labs at the present day scenario. We need to be absolutely accurate. Hence, the techniques of quality assurance, that internal quality assurance performed by the individual labs at its own level and forms the basis of day-to-day work that we have already discussed, that is in our quality control we are doing. But for the external quality assurance performed by many labs at the same time, monitored by one. And periodic monitoring of the performance of these labs, that is internal quality control, which ensures your precision, but external quality control will ensure your accuracy. Well, there that accreditation of the labs, I will not go into the detail because the paucity of the time, but nowadays in our country we are having National Accreditation Board for the laboratories under Quality Council India, and a good number of labs are already registered under them, and Professor A.K. Agarwal, he is also one of the esteemed member for our Quality Council India. Maybe he can throw some light into it. So
yes.
Before
yes,
we go
yes.
on to the accreditation of the thing, I think I would like to, you to cover that standard operative procedures which one has to have for a particular laboratory, and how the waste or the samples need to be disposed, because these are the two important areas.
Yes.
Standard operative. So if you can tell our learners about these standard operative procedures, which one need to be.
Yes.
Sir, you are
Okay.
the colonel, if you can tell our learners about standard operative procedures and how to
Yeah,
dispose
sure.
of the waste of the.
Yeah, as Professor Arora pointed out, about very important area is biomedical waste disposal, especially in the laboratories. It is covered under biomedical waste management and handling rules, as you are all aware. They are the statutory requirement, in fact. What happens normally is various samples like stool, urine, blood, they are being handled by the laboratory, and the laboratory workers are involved in this. And after the sample has been examined, the sample needs to be destroyed. In terms of, let us say, if it is urine or the stool, they have to be disposed of properly in the drain with plenty of water, and they should be disposed of in the sewage. And when it is over, the process is over, the containers need to be properly disinfected with the sodium hypochlorite solution. And also all the workers must use, the laboratory workers must use the gloves for handling this samples. Also the blood sample particularly is very important because it is very infectious, and this also needs to be drained off, and whatever the containers are there, they need to be again disinfected at the source. This is what is the statutory requirement. And all the standard operating procedures, as Professor Arora was also telling you, the standard operating procedure in each and every aspect of laboratory is important, whether that is from the pre-analytical portion as pointed out by Professor Das. Various procedures have to be done. How I will do the venipuncture, what is the procedure for venipuncture, what is the procedure for receiving the patient, registering it, making the label. If you are using barcodes, then sample have to be barcoded. If you are not using barcoding, then are you putting with the marking pencil all the details of the sample on the sample. Then you need not put the sample on the prescription paper, which will again add on to the infection control problems. Also, while collecting the sample, you have to use gloves and take proper universal precautions. Nowadays they are called standard precautions for the laboratory. There are also guidelines available for laboratory biosafety guidelines, which are been published by NACO also, and they are available everywhere. These have to be followed. Every procedure in the pre-analytical phase, analytical phase and post-analytical phase has to be outlined. This is a requirement for any laboratory under the quality control program. I think Professor Agarwal,
would you like to add?
Yes, very good. I think with regard to the standard operating procedures, especially with respect to the various clinical laboratory protocols, I think will have to be laid down. But as Colonel Rao has mentioned, the biomedical waste management is extremely important, he has explained to you that the samples which are how they have to be discarded. Sometimes we use the phenol solution to disinfect even these stool urine samples and then discard them into the sewer lines. And with regard to another serious issue in the biomedical waste management in the laboratory is the sharps management. Because sharps are, it has been described by the WHO in a study in 2002, which was done in 150 countries, that as a result of the improper sharps management, we have 22 million cases of HIV infections, hepatitis B infections, and then 2 million cases of hepatitis B and 2 lakh cases of hepatitis C. So the hepatitis B, hepatitis C and HIV are the most dangerous infections which are as a result of the needleistic injury on account of carelessness in the disposal of the sharps. So the sharps management, which is very ticklish, and that's where we have to have the standard operating procedures besides the universal precautions, how we should destroy the needle cutters, the needle destroyers, needle separators, and then of course the disinfection in the sodium, 1% to 2% sodium hypochlorite solution, the disposal of the ampules, the bottles, the glass, the scalpels, all these things, plus the plastics, that is also, and then the culture media, for example, from the biomedical laboratories, other chemical reagent solutions. Now these used ones, the culture medias, etc., because they are containing the microbes, they have to be microwaved. So microwaving of the laboratory leftover cultures and other tubings, etc., is another method of disinfection before we treatment of the laboratory waste. And then some of the waste will have to be autoclaved, and then maybe the tissues in the histopathological examination will have to be incinerated or deep burial.
Thank you, Professor Agarwal. Thank you, Colonel Rao. I think Professor Das has very nicely covered that what are the various aspects in the organization and management of the laboratory services, and subsequently it has been very well supplemented by Professor Agarwal and Colonel Rao about the safety measures and the standard operative procedures which one need to be follow in the laboratory. So if there are any questions regarding the laboratory, you can just throw your question to us and we'll like to reply. And if there are no questions, or if you want to ask a later stage, because we have very limited time, and in this limited time we have to make use of this time very judiciously. So what I will now we will do that, we'll go on to another important area, that is blood transfusion services. And as I told you earlier also, this is another important area in the hospital which need to be taken care in order to provide the safe and various components of bloods which need to be provided. So I'll request the Professor Das to just continue with his presentation regarding the blood transfusion services, how they can be organized and what are the precautions which we need to be taken care of the blood.
Thank you, Professor Arora. So let us start with this blood transfusion services. It is to a large extent very much that planning and management aspects are common to our lab services, but what you can say, the requirement of looking into the other aspects while we are planning and designing these transfusion services need to be much more careful, because unlike in the lab services, a wrong diagnosis, a wrong result might cause you a lot of trouble, but a wrong transfused blood might cause the life of the patient also. So let us look into it. What are our requirements, or what this blood transfusion service is? Now, human blood is an essential element of human life, and the blood is having no substitute. Blood is also a scarce resource. The availability of safe and adequate blood saves life.
Call from Jabalpur.
Yes, Jabalpur, please. Yes, sir.
I would like to know what the trolley
quality control of the laboratory survey, is it some act is there to have it compulsory?
Yes.
Okay. Yes, you NABL का बता रहे. There is
Yes, Dr. Tiwari.
yeah, there is no law as such.
Yeah.
As you are giving so much importance for the quality care in the laboratory survey,
Yeah.
for quality care, is it a compulsory or is it
Voluntary.
optional?
Yeah, it is purely a voluntary process. It is actually you are ensuring the quality of your laboratory tests to your clientele, that is the patient, and we should, as medical professional, should ensure that whatever tests are carried out in the hospital, in the laboratory, they have to be accurate. They have to be guiding the clinician in making a diagnosis. That is the aim, and there is no compulsion in this. No government law or any statute exists on this, but however, the patients are now demanding. Patients want that their results should be correctly done, and also yourself as a laboratory person, as a pathologist, you need to ensure the quality exists, in which actually your peers are checking the quality through the external quality control measures, and internally you are deciding your quality. You are checking some samples, maybe 10 to 25% of the samples are checked internally to state the accuracy of the results. That is very important, and progressively you will find that accreditation will be applied by most of the laboratories, because as I pointed out earlier also, that the patients are now demanding the service should be accurate, and quality service is being demanded.
So, Dr. Tiwari, it is, although it is not mandatory, but as a medical professionals to provide the correct diagnosis, it becomes our duty to ensure that the results are accurate, and for that random sampling and other techniques can be employed.
One more point, Dr. Arora, in the laboratory scenario is that today in big cities it has become a fashion to order a battery of the laboratory investigations. I think as medical professionals, especially in the private sector, we have to put a check that we should not order unnecessary investigations on our patients, and this is ordered with a vested interest at most of the places, in private practice particularly, and then unethical measures are adopted because more the investigations, more the benefit to the doctors who are ordering the investigations. I think those things also need to be addressed as far as the quality
I think
is concerned.
we have to be rational in while ordering for the investigations. We see that they are bare minimum, and those are very essential that we should get it done. I think we can continue with the blood transfusion services.
Well, as I was
We have
telling,
got another 10 minutes.
10?
We have.
Yeah.
Okay. Okay, blood is a scarce resource, no doubt about it, and if not properly screened, the blood becomes a conduit for transmitting life-threatening viral, bacterial and protozoal infections like hepatitis B, hepatitis C, HIV, AIDS, syphilis and malaria. Well, typically two categories of person who require this blood transfusion, that is those with emergent requirement, that is victims of the road accidents and other disasters, or are repeated, frequent, regular requirements like patients with thalassemia, hemophilia, renal dialysis, severe anemia, cancers, etc. Okay, so as per the definition, this transfusion service is a medical facility designed, equipped and staffed to procure, draw, process and store and distribute the human blood or its derivatives. In India, human blood covered under the definition of drugs by Section 2B of Drugs and Cosmetic Acts 1945. Drug is also taken, the blood is also taken as a drug. Several new policies and procedures related to the blood safety were introduced in Drugs and Cosmetic Act 1945 due to AIDS transmission through transfusion, and that have really made to make lot of these amendments in our act. In 89, test for HIV virus became mandatory. In 92-93, the Drug Controller General vested with powers of Central License Approving Authority. 1998, professional blood donation was banned. 1999 Drug and Cosmetic Act second amendment came into act, and 2001 test for marker of HCV and antibodies to HCV mandatory. The storage of the blood components, blood can be divided into the 6 components, that is the RBC, packed cell volume, the platelets, the plasma, FFP, cryoprecipitates and cryopreservations. So I am not going to the details, these are all in detail given in your modules. Now indication for the different components, that is the packed cell volume which have been given to the thalassemia, aplastic anemia, chronic hepatic failures and all these things. Platelets, when the platelet count is becoming less than 20,000 per ml, and you know that with this, thanks to dengue and all these problems, this has become one of the most known factor even for a common man also. Then FFP, where the prothrombin time is less than 1.5 times the control. The plasma, when that extensive surgeries, massive blood transfusion with RBC. Albumin, when the serum albumin level is less than 3 grams per deciliter, or in the liver transplant. Then cryoprecipitates, that is in hemophilia and hypofibrinogenemia. And whole blood, that is only in the neonatal exchange, and when the blood loss is more than 10% of the total blood volume in an adult and more than 10% in children. Please friends, remember, nowadays the expert says there is no scope for otherwise giving whole blood to a patient, first thing, and second thing, there is no scope of transfusing only 1 unit of blood. Whenever the requirement is more than that, only then we should go for this thing. Need estimation, I think we can go skip it. The planning for the blood transfusion service, there are the 4 basic factors, that is the functional criteria, workflow criteria, environmental criteria and equipment criteria. Location wise, that is functionally, that is the located at the ground level, close to the emergency service and close to the operation theatres, because these are the 2 areas where we require this in the bloods very urgently or emergently. The standard for the space for the blood bank, that is for 3 to 7 units of blood per hospital bed. We require 100 to 800 bedded hospital in that region. I am not going to the details of these things, maybe we can skip. The areas of the blood bank, that is the major areas which we must have in our blood bank, are the donor recruitment office, bleeding complex, therapeutic area, laboratories and administrative and the clerical offices. These are the virtually the main areas in our blood bank. The functioning of the blood bank, they really required to do the donor requirement, because as you know, there is no scope for professional blood donors. It should be only through the donation of the blood. That means donor recruitment through voluntary and or by replacement, screening of these donors, safe blood donation, grouping and bag marking, infection testing, component separators, final grouping and cross matching, storage and final distribution of the blood products. These are the functions of the blood bank. Now donor screening done in 2 stages, that is the preliminary and final. In the preliminary screening is done by the technical assistant. Information collected are name, age, sex and all these things, along with that BP, pulse, and you have got those standards, and you need to match if the patient or the donor, not the patient, if the donor is matching all those things and fit to donate the blood, only that apheresis that blood will be taken. And final screening, that is the donation done by a doctor. All the above informations are cross-checked and confirmed, as well as the history of any drug intake or drug interaction, previous history of illness for are excluded, like viral hepatitis, history of seizures, then diabetes mellitus patient, diabetic patient on insulin. So this kind of things are also to be eliminated or need to be checked. Now safe blood donation, that phlebotomy site is selected, that is the antecubital vein, and I am not going to the details of it. That is how this procedure is to be done. After the blood donation, the donors are sent to the refreshment room and donors are issued a card in form of remuneration, because nowadays you cannot or you should not give any other incentive in cash or kind for blood donation. So only the refreshment is some refreshments are given, and these cards are issued, that green card given to the replacement donor, that blood can be issued to the donor or the patient for 1 year from the date of donation, and white card given to the voluntary donor, blood can be issued to the donor for lifelong or his relatives within 1 year. For the donor it will be lifelong, but for the relatives and the friends only within 1 year. In the bleeding room, bag marking is done and 2 samples of blood are collected in the test tubes. Now, these are the few of the photographs, that is, you should have this proper waiting area. That is, the pre-donation counseling and guidances have been given. Then, help in filling up the questionnaire, because the donor is required to fill up this questionnaire and he may be helped or he may be explained the things. Then, proper answering of the donor questionnaires. Then, measuring or those physical requirements, that is the screening for the donor's questionnaire, height, weight, hemoglobin checking, ABO grouping. Then some post-donation feedbacks, and if you require, you can give some donor's appreciation in form of some token, that is a memento. Now, workflow of the blood bank, that is the donors or the voluntary replacements are coming to the waiting room. Then preliminary donor screening, final screening by a doctor, bleeding room and refreshment room. From the bleeding room, after grouping the bag marking and samples in 2 test tubes, that means the test tubes for laboratory testing, and grouping and cross matching and the component separators. But first and foremost, we need to do that infection testing lab, that is test for your hepatitis or HIV or syphilis and malaria. If any sample test positive for any of the tests, it will be discarded and all components separated from the same bag in the component will be taken care of. So, label on every bag of the blood, you must have the serial number, the license number, date on which the blood is drawn and the date of expiry, name and address of the blood bank, and colored label for the specific group. And friends, these are the colored label, that is for the O group it will be blue, for A group it will be yellow, for B group it will be pink, and for AB it will be white. So other than this, you should have the RH grouping and results of the test for the diseases. Here also we need to take care of this biomedical waste management for this thing, because blood is one area where almost our 100% our biomedical waste. So appropriate segregation of the waste, that is outdated bag, are injected with 1% hypochlorite solution and left for 12 hours, and then the blood is drained into the sink or bags are sent for shredding. Then you need to take the other universal precaution procedures against the hepatitis vaccination for all health staff, cutting the needle in the needle destroyer, mixing of the sharp objects are avoided, wash the hands with soap, use of the gloves while working in the blood bank. For wiping, the sodium hypochlorite solutions to be used, and test tubes and pipettes are autoclaved and kept in the corridor in front of the washroom. So these are the things I think in detail we have already discussed while we are talking about that laboratory services.
Yes, Ahmedabad, please come up.
Yes, I would like to know what are the various rules regarding the issue of blood.
Can you identify, Dr. Sahab, yourself?
Pardon?
Can you identify what is your name?
Yes.
Your name, Dr. Sahab?
Dr. Alka.
Dr. Alka. Okay. Dr. Rao, what do you like?
Sure. This requirement for the issue, again one must understand that this is different from the laboratory. Blood bank is a statutory requirement, and for issuing the blood you have to have a proper form filled up by the concerned physician or surgeon, whosoever has demanded. The indent should be properly made, and then it has to be certified by the blood transfusion officer that blood has been checked for all the diseases, mandatory tests have been carried out, and then only the blood is issued based on a proper indent form given by the doctor concerned. That is the major requirement as far as statutory requirement is concerned.
I hope, Dr. Alka, that answers your question. Now we'll, I think after covering these two important areas, that laboratory services and blood bank services, now we'll be going on to another area, that is the management of radiation department, and then the radiation hazards. So before we take up that, we'll have a break for 5 minutes, and then after 5 minutes we'll be coming back. Meanwhile, if you have got any question, you can fax those questions, or maybe when we come after 5 minutes, you can throw your questions to us.